Okay, so I think we get started. So firstly, a very warm welcome to this webinar on driving diversity, equity and inclusion. So thanks very much indeed for joining. Before I hand over to Diana for the agenda, just a couple of introductions. Next slide. So for those of you that haven't met, my name's Steve Wim, Society Business Director, and I work in Elsevier's Journals Group, also known as SDMJ. And I'm delighted to welcome my colleagues Agnieszka Freda, Executive Publisher in our Health and Medical Sciences Group, and Diana Jones, Executive Publisher also in our Health and Medical Sciences Group. And both Diana and Agnieszka, they are our leads on diversity, equity and inclusion. So very well placed to talk to us today on this very important subject. A couple of housekeeping items. So this session is being recorded and as ever, we will make it available to you afterwards, so do keep an eye out for that. And your audio will be muted as we go through the presentation, but please do ask questions using the Q&A function of Zoom, which you should be able to see on screen. And what we do, Diana and Agnieszka will talk through their slides and we'll come back at the end to pick up those questions. So with that, very pleased to hand over, Diana, over to you.
Thank you, Steve. Thanks for coming along. We're obviously talking about diversity, equity, and inclusion tonight. And in addition to the role that Agnieszka and I play as the gender diversity work stream, I'm also DEI lead for Elsevier in Australia. And since I'm based in Australia, I would like to respect the traditions of country over here and acknowledge the traditional custodians of the land I'm on today. That's the Gadigal people of the Eora Nation. I also acknowledge the traditional custodians of the lands on which you're dialing in from today and any First Nations people present. I pay my respects to elders past and present, and I recognise their ongoing connections to the lands and waters throughout Australia. So as I said, we're here to talk about diversity, equity and inclusion, and what better place to start than by defining what we're talking about here and also telling you why we think this is an important area. Then we'll talk a little bit about our approach and commitment to DEI. We'll talk about DEI and science, research and journals, and that kind of goes back to the why are we looking at this area? And then we'll dive into some of Elsevier's journal-related DEI projects, some of which I'm sure you're probably already familiar with, but some may be new to you. We've broken these down kind of artificially into 3 areas. We're going to start with those focusing on editors, authors, and reviewers, and that's more to do with sort of collection of data so that we have a base point and we know where we are. And then move on to Elsevier-wide initiatives. And actually, a lot of those initiatives are done in collaboration with other publishers, so the cross-publisher initiatives. And then we'll talk a little bit about journal-specific initiatives, and those tend to be driven by sometimes societies, sometimes editors, sometimes publishers at Elsevier. But we thought we'll give you a selection, and then as you know, societies, you may be involved in some of these already, or you may choose to sort of take some ideas and take them onto your own journals. Finish with some conclusions, and as Steve said, a Q&A. And Agnieszka and I are going to sort of do a tag team thing as we go along. So I'm going to make a start, and then just to keep you on your toes, we'll kind of swap between us as we go through. So to start with definitions, as promised, diversity essentially just refers to who's represented. So for example, different genders, ages, ethnicities, physical abilities, sexuality, geography, etc. Equity refers to the fair treatment for all people. Equity differs from equality in a subtle but very important way. So while equality assumes that all people should be treated the same, equity takes into consideration a person's unique circumstances and adjusts treatment accordingly so that the end result is equal, as the cute little picture in the middle illustrates. So it actually acknowledges that there are groups that face barriers and challenges and obstacles in doing the same activities, work as others, and aims to remove those barriers and obstacles or address those challenges. And finally, inclusion. Inclusion refers to the experience people have and the degree to which organizations, or in this case, journals, embrace all of those involved and enable them to make meaningful combinations. And it doesn't really make sense to have one of these in isolation. You really need to have them all together. So when we bring on board a diverse group of individuals, we need to have a sufficiently inclusive culture such that all of those involved feel that their voices are respected and heard, and also including them in a way that's fair and equitable and makes them feel welcome and that they belong. And now just a little bit of context. I have to say, this wasn't my original slide, so I might argue that the history of the topic is longer than equal opportunity law. You could say it goes back to probably the suffragettes or even before civil rights movement. But certainly now it's considered to be an important part of any healthy organizational culture. And here we're kind of, as a business, I guess, biasing towards business, but I think we're talking about all organizations. And it's not even just a hot topic in leadership. There's evidence that DEI leading organizations perform better, and as do diverse teams, and not just in a business or organizational setting, but research shows that that's in a research setting as well. So it's particularly pertinent here. And as I said before, you need all three to work together, and some may argue that they should be in different orders, but for the purpose of this presentation, we're essentially just going to refer to diversity, equity, and inclusion, and probably use the old three-letter acronym DEI quite a lot. I also mentioned that there are different dimensions of diversity, and one thing to point out with this presentation is that there's probably going to be something of a bias towards gender, and we apologize for that in advance, but we will cover also some issues related to race and ethnicity and work that we're doing in that area, age, geographic location, essentially. You have to start somewhere, really. So those are the ones we're starting with, and we recognize that we're at the start of a very long journey here, and that other dimensions need to be addressed as well. And we also recognize that there is intersectionality, and that none of these dimensions exist in a vacuum, and there's often overlap and often multiple dimensions going on at the same time, and those need to be addressed going forward. And finally, we're making a distinction between DEI in the organizations we work in versus DEI in our publications and the communities that we serve. We could probably do an entire presentation on DEI in the organization we work in. There's a lot going on at Elsevier, and we will mention that in passing, but our focus for this particular presentation is DEI in the communities, in the publications and the communities we serve, i.e. our the likes of you, our societies. And now I'm going to pass over to Agnieszka to cover the why are we talking about this.
Hello. So a little bit of setting the scene. We talk about it a lot. I wouldn't want to say every day, but probably. And something that we meet very often is, haven't we already done that? Especially when we talk about gender, haven't we talked about that? Haven't we already addressed it? Well, I have a few examples here for you, just to show you how we have not really addressed it, that just talking about it doesn't make the issues go away. Some of the examples are funny, like the problem with the lack of suitable bras for women joining the army. But it is a very good example of the fact that for a very long time, a lot of spaces were not available for women. A lot of professional spaces were just shaped by men. And we were, the doors opened, or we rather barged through them at a certain stage, but that's actually not that long ago. And what we see is that we were let in. However, the rules are still the same rules. And a lot of things have not been reconsidered to adopt to the fact that there's second half of the population that might have different needs. So maybe the bra, it could be a bit funny, even though if you're not a woman, you can ask a woman if having a bra that feels like a swaddle is a good thing. But there are other things like bulletproof vests used in the army, used in special forces, used in police, that are based on a man's body, which means they don't really account for breasts, for example. So when you think about the bulletproof vest, if someone who has breasts wears it, it suddenly lifts up, creating much bigger opening in the armhole. And then it means that actually someone could die from the fact that the equipment is not adjusted to their body shape. And that perpetuates in not only in the army, in space, in police forces as well. It goes into equipment and agriculture, etc., etc. So as well, we know already quite a lot about differences in sex, for example, in terms of our immune system. And we know as well after the COVID pandemic that many more men died from COVID than women did. There is a bit of intersectionality in there between sex and gender, so whether it's biological or it is connected to behavior. However, we know as well that women's immune systems react much stronger to any type of virus. So I think this is a very good example of showing that if we really spend more time on this, if we look at the differences, if we study them deeper, it's not only women benefiting, that would possibly, there's there an option for that to become beneficial for the men. And what we still see, even though we think it's all addressed, that women are still underrepresented in clinical trials. So even though there are a lot of diseases that are more prevalent in women, they're affecting women more, that we don't have enough treatments that are tailored to women, we still don't have enough women participating in clinical trials. As well, we know that safety measures, so a little bit still health related, but going more into physical sciences, we know that we have different skin depth, we have less hair, we have different constitution density. That actually translates as well into safety measures, and majority of safety measure, whether it's for chemicals exposure or radiation exposure or car safety, all of that is based on the male body and is actually not safe for women's body. The same is as well in terms of geographical representation. There are a lot of things that the so-called global north says is the best practice. We've had a very good article published by Lancet that showed that, for example, antiseptics recommended for surgery that were recommended by the global north are much more expensive than other antiseptics that would be used in African setting that are much more affordable and almost as good as. So what it means basically, we have to have, when we looked at the definitions of diversity, equity, inclusion, we have to make sure to start with, we have all the people at the table to ask the right questions. And we see scientifically, and Diana at the end of the presentation will show lots of references, that this is the case. We need broader representation at the table in order to make sure things are equitable and that the size is better. And going forward, before we move on to how we approach it, so next slide, Diana, please. Something that I feel is very important to say, and that's actually a quote from Invisible Women from Caroline Criado Perez, is that the gender data gap is not generally malicious or even deliberate. Quite the opposite. It's simply the product of a way of thinking that has been around for millennia, and therefore a kind of not thinking and a double not thinking. Men go without saying, women don't get said at all, because when we say human on the whole, we mean men. And if you look deep into the data that we work with and actually now is being fed into AI tools, still majority of it is based on the male and men experience. So what do we do about it? What's Elsevier's approach? Well, we know there's no silver bullet. A wonderful start is with our own CEO Kumsal, who from the day she stepped into her shoes, she brought inclusion diversity into the forefront of everything that we do. And it's good to recognize that has been progress has been made, and that we have done work. However, there is no single solution here, and the entire research ecosystem must come together to drive the lasting change. And recognizing as well that we are part of that ecosystem and we have to do our homework as a publisher as well. So looking at our approach, we are not in vacuum, and we always start and end with our community, which means you. We cannot do anything. We cannot make a significant change if we don't work side by side with our editors, with our reviewers, with our authors, with our society. At the same time, we recognize we're not the only publisher. It's good if we make changes, but those changes should be introduced across the board, across the industry. And that's why we work together with the Royal Society of Chemistry Joint Commitment to IND, which includes 52 publishers. We share ideas, we run it by them, we get feedback, and we all learn together. At the same time, we have an Elsevier's IND advisory board. This constitutes mainly of external stakeholders. These are key opinion leaders on IND who give us ideas, who give us feedback on what we're doing, and bring to new thoughts, and criticize as well what we are doing in order to make everything more connected to the reality. We have external, as well, apart from external stakeholders, we have internal committed experts, and at the same time we work with funders and institutions supporting research. We, of course, play a very important role in the publishing process and dissemination of knowledge. But when you think about it, by the time the paper comes to us, the grant has been given, the research has been designed, formed, and we really are quite late to capture any lacks, for example, in design for accounting for sex and gender analysis or any other aspects of diversity. So we have to really work all together to make sure that we start from the very beginning of a thought about research to the very end when we disseminate it and apply it. We put data as the last piece because we know that data on its own is meaningless, but what we've learned as well, that without evidence-based approach, we struggle to move the needle. We really need to know where we are. So if we talk about gender diversity, geographical location, or race and ethnicity, we really have to have some sort of idea on at least an estimation where we are right now in order to see if any new any changes and the new initiatives actually moving the needle. And then we have to know as well which areas need our attention first. And then we go back to you. As I say, it starts with you, it ends with you. We cannot do anything without our community. We cannot do it, especially without our editors and societies. So we're looking forward to working on that with you closer. And I think now it goes back to from
Back to
Netherlands
me.
to Australia.
Thank you. So essentially the premise we're working to here is that diversity, equity, and inclusion lead to better and more fair science. So science that's more accurate, more precise, more rigorous, more reproducible, more generalizable, and better represents the population and applies to everyone, not just some of us. So this means that research can address a wider range of questions. It can have more impact on all sectors of societies, and we benefit from exposure to new and potentially possibly previously underrepresented ideas as well. So as Agnieszka's covered, in order for the right research questions to be asked and the answers to be scrutinized, we do need diverse groups to come to the table. So she's given you some examples already, but others, you know, do we check this car safety for different body types, for example, and then exploration of why women have disproportionately worse outcomes in cardiovascular disease than men. Have enough trials being carried out on women? Do they even need the same treatment or the same dosage? You know, do women find it harder to adhere to post-operative rest because they feel the need to resume their caring duties, which they often take the burden of care? So there's plenty of additional questions to ask there. And then to move away from gender, because I realize we've been focusing a lot on gender, you know, when designing a global vaccine, we may need somebody from a different country to point out that storage at minus 50 degrees centigrade simply isn't possible in all parts of the world. So just to summarize, facilitating DEI in publishing means that researchers of all backgrounds can excel and advance. A wider range of research questions can be considered and addressed. More rigorous and high quality studies are conducted, and more equitable and impactful research outcomes are published for the benefit of society. And at the risk of laboring the point, I've just got two more things on this, a couple of common myths. And I'd like to thank Isabel Goldman for her excellent Research Academy presentation on DEI initiatives at Cell Press. These are quotes from a special issue that was published in Cell on Juneteenth in STEM. So the first myth is essentially, why don't you just stick to the science? You know, why are you focusing in on politics and social issues? But actually science can't really be isolated from society. What happens is that science shapes the research agenda, and the science we produce impacts our society. So I think the quote on the left summarizes that quite nicely. And also a broader, more diverse approach to science leads to better solutions. So why would you limit the populations that you're studying and the questions that you're asking? And then the second common myth is that science is a meritocracy, that we shouldn't be looking at DEI because what matters is merit. The cream will always rise to the top, only it doesn't. This isn't actually a level playing field, or any other analogy that you care to use. Certain groups do have barriers. Not everyone begins at the same starting point, and some people are more privileged and can make their way through with less obstacles than others. So there's a nice quote about that on the left-hand side of the screen. And then, as Professor Margaret Scheel says in another article, talent may be broadly distributed, but opportunity is not. So taking all that forward into journals, what does that mean? We feel that as publishers, societies and editors will have a shared responsibility for promoting DEI by firstly appointing editorial teams with not only a broad expertise, but also a broad background. By considering all submissions with an open mind and trying to reduce or at least minimize bias that might come to the table, by diversifying reviewer pools and invitations, and whilst appreciating it's tough enough to find reviewers anyway, and commissioning content from a diverse range of authors. So now we get into the sort of nitty-gritty of the projects that we're working on, and the first three are very focused in on editors, authors, and reviewers, and they do come back to that data side of things that Agnieszka was talking about, that we need to kind of know where we stand in order to know what needs improving. The first project is the one that Agnieszka and myself are working on, which is prioritizing the editorial team gender diversity. The second one is sharing in a transparent way the self-reported gender of editorial teams on our website, so having some transparency around that. And the third, which you might have heard of before, you might have heard of all three, but there was a separate webinar on the collecting or inviting authors, reviewers and editors to share their self-report, their race, ethnicity and gender within Editorial Manager. So I'll just dig a little deeper into some of those. But before I do, here we are. This is where we are, or we think we are, with women on our editorial teams. You can see there that the Lancet is doing really well indeed in terms of the percentage of women on its editorial boards. And with Elsevier as well, we've made some fantastic progress. And I think we kind of hope we got above 30% in 2023. The progress is slow, but we're still chipping away, and we're still trying to make a difference here. And do bear in mind that the one on the right is across all science. And so you obviously have some particular challenges in sort of physical science areas where there's there's a minority of people working in that area anyway. And the other thing to point out about this is this actually reflects the proprietary journals. Just I think for the simple fact that in a society journal, typically a society will select an editor and an editorial team. So I think we've sort of made a decision not to have that information on this particular slide, although we do have some information about that as well. So what can you do to help? Well, commit to increasing the diversity of your editorial teams would be a great first start. And define some objectives and actions, and we can help with that as well. Obviously, here again, we're starting with gender, but also considering global representation, race and ethnicity and career stage. And in order to support this, we can provide the data for each journal and also some helpful benchmarking information. So we can provide data of the current estimated gender participation on a journal's editorial board, and that's a combination of self-reported data, which is supplemented by some predicted gender data from the NAMSOR gender algorithm, which, as you know, is not perfect, but is about the best that we've got in this field. And then we can also compare that to the data of the estimated gender participation of authors in your journal. So you can say, well, this is our editorial team and these are the people publishing. And then the data of the gender participation of researchers in the field of study that that your journal sits in. So you've got some really nice benchmarking there so you can make some comparisons. And we can also provide some other supporting materials to help with this, which would include, breaking down the best reviewers. Let's have a look at those and see if any of those deserve to be kind of put onto the editorial team. Looking at prolific authors in the journal or even in the field to identify candidates. We also have some sample approach letters that have proved quite successful in bringing in people from diverse backgrounds, take a slightly different approach with that. And that's been interesting to see how that works. We have some advert wording as well, which again might be helpful in bringing in a more diverse group of people. So this is just an example of what you might see at a society meeting or an editorial board meeting. You've got your pie chart on the right with how the journal's performing in terms of the estimated gender. And then we've got in red on the third bullet point, how does that compare with the percentage of women and authors, and how does that compare with the percentage in the field? And those are now sort of part of our standard deck, so hopefully you should see that coming from a publisher near you soon. And then transparency of self-reported data. So at the moment, we have around 12,000 journals displaying the self-reported data of their editorial teams. And this is limited to self-reporting, by the way, which is a challenge to get. So most society journals do not yet make this data available, and one of the reasons for that is that the level of self-reported information for society journals tends to be lower. So we'd really like to work with you during 2024 to try and get that up so that we can be more transparent about the makeup of our editorial teams. And all journals also display geographical distributions of their editorial boards online. Finally, and I think we've been through, like I say, there has been a separate session on this, but we did roll out gender, identity, race, and ethnicity questions for most Elsevier journals as part of Editorial Manager in 2022. We expanded that to many society journals in 2023, and we should be in a position to provide journal-level aggregated results in 2024. Again, we started with gender and race and ethnicity. That doesn't mean to say that's where we're going to stop. But it was a lot of work, as the project manager will tell you, in developing the schemas using quite a rigorous approach. This was a cross-publisher initiative as well, and there was a lot of input from experts as well. And just a few things to note: users are in control of their data, and they can update or delete at any time in line with privacy and, in Europe, the GDPR policies. They have the option to prefer not to disclose, which is also fine. The user data is totally safeguarded, again, in line with privacy policies and guidelines. Will only ever report on an aggregate level, and the information cannot and will not be used during the manuscript review process. So this is really just to provide aggregated information, and privacy is always protected. That's our #1 priority. And now I think it's back to Agnieszka.
Yes, so I'll talk a little bit about some initiatives that we took across Elsevier portfolio. All of them are connected to journals. However, they sort of are not connected to individual journals, but across our whole ecosystem. So in 2021, we implemented the inclusive name change policy. As you know, a scientific record normally cannot be changed once it is in its final version online or in print. Any changes should be recorded with the corrigendum, erratum, or editor's note. But we realized that there's a group of people that keeping a record of changing a name, for example, if someone is going through gender transition, it might cause actually risk to the particular individual. And as well, when we have women who get divorced, want to go back to their maiden name, it creates multiple profiles for the same person, etc., etc. And this is actually quite a private thing to know that someone changed their name. So we have a very stringent procedure in place by an ethics team. But if someone needs a name to be changed, it now can be done seamlessly after review by the panel. And there's no mark on the original record. Another big thing that we have implemented is the sex and gender reporting guidelines for authors. So this was a very big exercise that we took on in partnership with the Cell Press and Lancet that are part of Elsevier. And we all align to make sure that we all say the same thing. So we aligned with SAGE guidelines to support improvement of sex and gender-based analysis and research. So there are clear guidelines now on the language that should be used, what sex means, what gender means. And the idea is that we start best practice, we standardize terminology, we improve precision, and we promote inclusion and reduce the risk of language misuse. Main principles based on SAGE guidelines. However, we have extended it to make sure that it is actually even more inclusive than SAGE guidelines, that no one is being missed by research. You were invited to include it in your guide for authors. I'm not sure how many of you took it on, but in the end, we have managed to have over 2,300 journals taking it up, which is majority of Elsevier journals. And we made sure that any journal that publishes on human subjects, animals, or eukaryotic cells has that text included, especially proprietary journals, because a lot of journals think they don't. And when you look at their content, even if they publish on chemistry, even if they publish on physics, they tend to publish at least part of the article that includes human subjects. The next initiative I wanted to mention is the change of inclusive peer review terminology. So as you might have heard, we used to call it single blind and double blind peer review, and showing you how important it is to have representation. We needed to have at least one visually impaired colleague joining Elsevier to point to us that this is actually not a very inclusive term. And then we changed it to single anonymized and double anonymized peer review. Another thing we wanted to mention to you is an initiative we launched last year, which is Editor Life-Changing Event Framework. As you know, majority of our editors are contractors, so our relationship with them legally is different than with our employees, which basically means we cannot offer them benefits. At the same time, we realized that, of course, there are situations where editors, not due to their fault, but just due to certain circumstances, cannot perform their duties for a short period of time, whether it's becoming a parent, a carer, losing next of kin, or being in the middle of a war, which is more and more, unfortunately, real in these days. We have to have a way to be able to keep them and support them in that time. So this is available for proprietary journals. If this is something your society would like to consider and learn about, we have now a full guideline with that was created with HR and our legal colleagues to make sure that everything is seamless and clear. Another thing that we offer that's fully available to everyone is Training on Researcher Academy. There are a lot of really great webinars there for different stakeholders, for authors, reviewers, editors. There's the wonderful webinar that Diana already mentioned from Cell on what they have been doing as a group. So I highly encourage you to use those and actually share with your communities. And moving on to the next one. At the last but not least, I wanted to mention we have actually launched journals that address different needs that are not, we feel like, are not fully covered. One journal launched last year was called Rare, that focuses on low prevalence diseases. And the second one, as much as I'd like to talk about it, this is a journal that Diana launched and is working closely with the communities. So I pass it on to her to talk about that wonderful project.
Thank you. Yeah, this is a project that I'm very proud of. So we've been working with the Loitra Institute in Australia, which is Australia's first Indigenous community-controlled research institute, to launch a new journal, really focused on publishing culturally authentic research by First Nations researchers for First Nations people. In Australia, as with other countries that were colonized, there's been with Indigenous populations, the health and well-being of Indigenous populations is on the whole very, very poor in comparison to non-Indigenous populations, and that's the effects of colonization. But also there was research in the past that's been not including First Nations people, and that's also had a negative effect. It's not been culturally authentic research. So this journal is different in that it's led by a team of leading in international First Nations researchers. It has to have substantive contribution by First Nations authors. All articles are reviewed by at least one First Nations reviewer and another expert in the field. And we're really, I think, revisiting the policies to sort of decolonize them and check which journal policies are culturally appropriate and which aren't. And it's still an ongoing piece of work. The first issue was already published in 2023. It isn't, even though it's born in Australia, it is an international publication. And it's open access with article processing fees waived until the end of 2024. So like I say, very proud to be involved with that one. Okay, so we'll finish with some other examples of journal-specific initiatives. Often, as I said, these are led by societies, publishers at Elsevier, and editors. So in a moment, I'll do a deeper dive into the first of those two, some special issues and some not just invited articles, actually articles, commentaries, editorials. But first, I'd like to highlight a few other initiatives. So the Associate Editor Fellow, and I think people call that very different things as well, but also the Early Career Editorial Board or peer review subgroup. These initiatives have proved to be a great way of bringing on board a younger generation and also underrepresented groups into journals by offering mentoring, hands-on experience, training, essentially encouraging them to get involved at an early stage in the peer review process and even editing responsibilities. And we have a journal in Australia, Heart, Lung and Circulation, that has a great program managed by the commissioning editor, Anne Gregory, which is fantastic. And I know one of Agnieszka's old journals, Drug and Alcohol Dependence, does that as well. And I believe the Healthcare Infection Society in the UK have a similar initiative. So there's quite a few examples of those. And some of them have been in place for a long time, and the editors have already moved up through the ranks. The other one is lived experience peer review. This is obviously not going to be relevant in all fields, more in sort of social and health science fields. But for example, the Lancet Psychiatry has a panel of reviewers who are also users of mental health services. So it just brings an extra perspective to peer review. And then finally, Journal Society Awards. So for example, one society in the parasitology area has an annual grant that supports disadvantaged researchers. And I believe they recently funded a researcher displaced by war in Ukraine to attend their conference. And another society in engineering field, which I think is going to be featured in a Society's Update article, which is just about to be published, gives a DEI award for outstanding contributions to the advancement of diversity and inclusion within the society. And that one's sponsored by Elsevier. So that's a really nice initiative as well. So some of these special issues, this initiative, sort of Women In series, I think it's actually been going for a couple of years, but we really just formalized it in mid-2023. And the content of this special issue will obviously vary based on your the subject area you're working in. So for example, in the health science area, it might involve the populations or the patients that you're studying. But in general, contributions are typically welcomed from investigators who self-identify as a woman as first corresponding or lead author. And these have been quite successful in helping to attract more women authors to publish in each journal, and also potentially providing editors with candidates for future board members, editors, and can also perhaps be a sustainable way to grow the journal if they're arranged every few years. So since we have some information available for publishers to share with you, so if you're interested, please reach out to them. We've got about 50 special issues in this area commissioned since mid-2023 across all science and mostly proprietary journals, I think, but it might be something that's of interest to you. And then if we take a look at other journal initiatives, journal special issues and collections, I think I already mentioned the Juneteenth in STEM cell special issue. There are a few other cell press special issues there, inequities in reproductive health on the left-hand side, for example. The Lancet special issue Advancing Racial and Ethnic Equity in Science, Medicine and Global Health was published last year, and I think they had big launch events and was extremely well received. There was one down in Australia. The journal I mentioned recently, Heart, Lung and Circulation, gets a couple of name checks here, but they published a great issue on women's heart health in 2022, which I may or may not have called on for some of the facts that I was, evidence that I was giving you before about women's cardiovascular health. And Cell Press does a number of collections, Building Inclusivity in Science and Women in Science. And then just some random examples here within Elsevier of invited editorials, comments, commentaries, submitted papers, which can just provide commentary on the state of DEI in a field, or it can be a call to increase DEI in a field of study, or even within a journal community. So we've that's really down to editors, and I think a lot of papers are getting just submitted in this area now as well. And just to show that I'm not too biased towards Elsevier, although there's a few Elsevier publications here, I just also wanted to share with you, and I don't expect you to be taking notes on this, and we'll send around the slides afterwards, but there are some really great research articles here and commentary articles, which we've used to inform this presentation and other presentations, and the work that we're doing in the field. Obviously, we're a research publisher, so we're trying to be as evidence-based as possible, and there's some fantastic articles here. So we'll finish off with you, Agnieszka, I think.
Yeah, so just to close and summarize a little bit, hopefully we have given you some ideas you can take back to communities. But we wanted to make sure that both clear business case and more imperative go side by side. So we want to do what's best. We want to do what's right. But in the same time, we see this is what's best for science. We are making progress. We're doing our best to transform it a more diverse, equitable, and inclusive organization. We're not there, and it's very important to admit it. The more questions we ask, the more we see there is to be done. We've learned the hard way that gathering reliable, diverse data is a first step. It's not the objective in itself, but it really is a key piece of this work as well. And we do need a structured approach. So we really need to have a plan. So when we ask the question, when we find the space, when we think something needs to be better, immediately we have to come up with a plan, what we're going to do about it, how we're going to measure it. We can be the catalysts, so we take that on. We can be the catalysts of change through our stuff, and we can be the catalysts of change within the journals as well. We do need to focus on all dimensions of diversity. We are starting with gender because it affects half of the population, actually the whole population, but we cannot forget about intersectionality, and we're looking at aspects as well. And we do take it really seriously that diversity, equity, inclusion is part of a broader corporate and social responsibility and discussion. So thank you so much for listening in, and I think we're ready to answer any questions you might have.
Great, thanks, Agnieszka. Thank you, Diana. Great, really interesting. And clearly a lot of stuff there, although we've aimed it at journals and research, clearly a lot of the principles apply more broadly, which I think is great. Any questions from anywhere, please do line them up in the Q&A that you should see on your screen. While we're waiting for that, you mentioned about, I guess, the focus at the moment is on gender. There's other stuff to come. So what are the plans, I guess, for the next year or so? Are you good to have some insight on that?
Agnieszka, over to you.
Okay. Yes, of course. So as we mentioned, we're gathering the gender, race, and ethnicity data on EM. We have a lot of data right now. We actually have a minimum viable product as far as the dashboard is concerned, right? So we're now starting to ask questions. Okay, what we'll do in this, how we want to see the data, how we have to visualize it in order to be able to understand where we are as a community, and then create an action plan. So 2024 is really going to be focused on understanding what questions we need to ask and how we visualize it, so then we can move on forward. So gender is part of it because we have much closer relationship with our editors and editorial boards. That's why we already have more data on gender on that group. But of course, authors, reviewers, this is a much larger group. This is why we went on as well, not only with gender, but the race and ethnicity. So this is the data that we're really looking forward to analyzing more deep. And we do have geographical distribution. That's actually one of the easiest. at least of editorial board. So that's the next extra step that when we talk about gender, immediately move on. Can we, as the minimum, reflect the community that we serve, right? So if we have a geographical distribution of authors, can we make sure that at least that is reflected by the editorial board? And we still lack there as well.
Great, thank you for that. Question here from Christine. Thank you, Christine. Have you any advice on how to find researchers from underserved communities for editorial boards, particularly if they're not in the Elsevier ecosystem already?
Yeah, it's a challenging one. I mean, we're also a little hamstrung in terms of gender with the GDPR compliance issues. So it is challenging. I mean, I think we as I mentioned, we could look at the reviewers, we can look at authors in the field. We can, we have access to Scopus, so we can draw names from there. But then we really can just we can using Scopus, we can look at how they're performing as well, and what their publication record is. So we do have some ways of analyzing people in the field and finding people in the field. But then it's essentially, it's kind of like, here's a group of people, what do you think you need to do next? But there's certainly Scopus to use as a source for researchers.
Yeah, I found Scival as well. You might not have access to Scival, right? But we as publishers have, and that can be very useful when we look for a little bit outside as well of the journal, looking for prolific authors and then trying to drill down to geographical location. That can be helpful. And I found as well, it's great to work with our networks. It feels a bit, a lot of people feel uneasy inviting names from databases, but I think we have to combine, we have to give people a chance, we have to give them opportunity to at least try and join the network, even if we don't know them, if we know only them by name and their work.
I think there's in this article that's just about to be published, which you might be interested in reading, as one editor who he said he was pretty much looking at conferences in the field and taking a look at who the invited speakers were. And maybe you could get some ideas from that. If you're being invited to speak in one of the major conferences in the field, then that could be a good candidate for you as well. So there are other sources as well, like, as you say, in networks and beyond.
Great, thanks both. And Christine, probably worth having a conversation with your publisher.
Which is me.
To loop back to them. Oh, is it? Sorry, Diana. Yeah, okay. There you go. Face to face. Anything to add, or any last comments, Agnieszka or Diana? If not, we will close the meeting. No, okay, well, with that,
just thanks for coming.
Yeah, great. Okay, so with that, thanks very much, everyone.
Please also let us know any feedback of other things you think we should be addressing in my field. I think that would be helpful for us to know if we you think as societies there's priorities that we're not currently touching upon, then that'd be great feedback to have. Yeah, absolutely. So anything on inclusion, diversity, equity, feel free to loop back to your publisher or us. And indeed, any other webinar topic that you think would be of use to you, then please do feed that back. It's great to have that information. So with that, thank you very much, Diana, Agnieszka, for joining, and the panelists. Thank you everyone else for joining the webinar, and have a good day. Thanks very much.